With a bad enough injury, a person can bleed to death in 5 minutes. But I have 2 bleeding disorders, so I could easily beat that time.
I gotta pump those numbers up. Those are rookie numbers in this racket.
Today, I'm going to try to convince you to get you and your kids tested for bleeding disorders, which is what we're going to learn about, particularly hemophilia and von Willebrand disease, or VWD. You know, VWD sounds like an STD. And now that I think about it, I said I had VWD on a first date and she never came back from the bathroom. We found out I had a bleeding disorder when I was 2 years old. I slipped in the tub, fell down face first, and bit my tongue. My mom said I turned as white as a piece of paper from the loss of blood before they got me to the hospital. Prior to that, we had no clue bleeding disorders ran in the family. Because I couldn't just sit the fuck down and take a bath, everyone in my family had to get blood work done, as well as a bleeding time test. If you don't know what that consists of, think of a device that looks like a stapler, but it just makes 2 big-ass scars you get to keep for the rest of your life. We found out I got it from my grandma's bloodline, which explained why she almost bled to death during childbirth. But of course, at the time, she never looked into the matter. That was one tough woman, y'all. Some of her final words to me as she was dying in the hospital were, "You couldn't come visit me at home?" VWD is the most common bleeding disorder, affecting about 1% of the population, and found in both men and women equally. Named after Dr. Erich von Willebrand, who discovered it. Thanks, Doc. You could have just left it undiscovered. Common signs of VWD include frequent nosebleeds, easy bruising, heavy menstrual bleeding, heavy bleeding during childbirth, excessive bleeding after surgery, and excessive bleeding after dental work. My dentist hates to see me walking through the door. Von Willebrand disease is a deficiency in von Willebrand factor, or VWF. VWF is the protein that makes platelets stick to the wall of an injured blood vessel and stick to each other. VWF helps in the repair of damaged blood vessels by binding to collagen and other proteins. VWF also prevents excessive clotting.
I don't know how to put this, but I'm kind of a big deal.
VWF both helps protect factor VIII and get it to where it is needed. VWF interacts with endothelial cells and helps in the release of other clotting factors. Only about 1/3 of the body's VWF is floating in the bloodstream. The rest is in storage, or, in my case, not in storage.
There are several different classifications of VWD. In type 1 VWD, the body has lower than normal levels of von Willebrand factor and potentially low levels of factor VIII, another blood clotting protein. In type 2 VWD, the body makes normal amounts of von Willebrand factor, but it does not work the way it should. There are 4 different subtypes of type 2 VWD. In type 3 VWD, the body makes very little or no von Willebrand factor and also has low levels of factor VIII. Type 3 is generally considered to be the most severe type of VWD. In extremely rare cases, adults who suffer from autoimmune disease, heart disease, or certain types of cancer can acquire VWD. The best place to diagnose a bleeding disorder is at a hemophilia treatment center, or HTC. Here, your hematologist will perform various tests to evaluate clotting capability, platelet function, and factor protein levels. Some tests may have to be repeated because von Willebrand factor levels can fluctuate in the body. Treatment for VWD depends on the type and severity. The most common treatment, DDAVP, boosts factor levels in the blood. It can be taken by injection or nasal spray. Other treatments may include injections to replace missing factor proteins, agents to help prevent the breakdown of blood clots, and for women, hormone therapy, such as birth control pills.
Like hemophilia, VWD is passed on through genes and tends to skip a generation. Thanks, Mama. I really would have just been good with the recipe to your yeast rolls. Unlike hemophilia, people with VWD rarely bleed into their joints. Hemophilia is also caused by a lack of specific clotting protein in the blood. Hemophilia is mostly found in males. While women are less likely to have hemophilia, they can carry the gene for it, and around 20% of hemophiliacs are female. Hemophilia occurs in all races and ethnic groups. Imagine having hemophilia and sickle cell disease. Just shoot me at that point. About 80% of those with hemophilia have hemophilia A, and around 20% have hemophilia B. Hemophilia A is a deficiency in factor VIII. Hemophilia B is a deficiency in factor IX. There are about 400 babies born with hemophilia in the US each year. This makes it about as rare as triplets. It's even more rare to have more than one bleeding disorder, such as I do, which means I had a better chance of having 2 twin brothers.
That's rotten luck.
Hemophiliacs tend to have a lot of issues with their joints. No, not those joints, but my hematologist did ask if I wanted a card. I'm sure I'm about to get popped for a random now. By joint issues, I mean, have you ever seen someone who sprained an ankle and how it swells, gets warm to the touch, and they can't really move it without pain? Well, this is what a joint bleed looks like and feels like. If I step out of the ambulance too hard, I'm probably going to walk like a zombie for the next few days. A Dawn of the Dead zombie, not a 28 days later zombie. Hemophilia damages joints through repeated bleeding episodes, or hemothrombosis, leading to hemophilic arthropathy. I think I said that right, which is a form of arthritis. Over time, the bones can wear away, leading to pain, swelling, stiffness, and a reduced range of motion. In severe cases, a joint can become permanently damaged. My left shoulder sounds like someone carrying stones inside a duffel bag. The clotting factor medication I take is factor IX, and it is incredibly expensive. So it wasn't until I was an adult with good insurance did I start on clotting factor. Even then, only because my blood brother and good friend educated me and practically pushed me through the doors of my hematologist. Getting comfortable starting an IV on myself took way longer than it should have. I have seen little kids with hemophilia who could start their own IV and they make me look like a giant wimp. More recently, they have come out with clotting factor medications that can be given SQ or IM without the need for an IV. Which, that's great and all, but I like how they come up with that now that my veins look like this. Okay, so what if you encounter someone who has a bleeding disorder and is severely injured? Standard bleeding control methods are still to be followed, but I would be more aggressive with holding direct pressure. And also understand that internal bleeding is going to be the biggest concern.
When it comes to management, the first point is, hemophilia patients can help you design their care plan. Most hemophilia patients are highly knowledgeable about their disease. After all, they've been living with this congenital disease their whole life. They're usually able to self-diagnose a bleeding event. They're familiar with their treatment regimen and schedule, and most severe hemophiliacs self-manage their disease at home. Also, most bleeding events are hidden in joints or muscles and cannot be easily validated. So, if a patient says, "I know I'm having an early bleed," they're probably right. You may be wondering, if hemophilia patients self-manage their disease, why would they even come in for an urgent care visit? For starters, not all hemophiliacs have been trained to do their own infusions at home, so they may come in needing factor replacement for a typical joint or muscle bleed. Others may need treatment for an exceptionally severe bleed or after an accident or trauma. So there are hemophilia patients out there who need your care, and often they can help you design that care. The second point is, don't delay treatment by doing lab work and imaging studies. While this may seem like a departure from standard emerge department routine, if a patient comes in identifying themselves as a hemophiliac, you should assume that any disturbance of function is a bleed unless proven otherwise, and you should treat them with factor replacement therapy as quickly as possible. You don't have to prove that they have their congenital disease by waiting for a PTT result. If you think an imaging study is indicated, go ahead and order it, but treat the patient first, then do your tests. The longer treatment is delayed, the greater the morbidity and the worse the outcome. So focus on treatment, not investigation. If your blood bank doesn't have the specific treatment in stock, in a pinch, you can use cryoprecipitate for factor VIII replacement and FFP for factor IX replacement. You can add tranexamic acid too, which helps in some cases. Point 3 is a related one. When in doubt, treat. The message here is not to worry about overtreatment. When it comes to hemophilia, overtreatment of a bleeding event with replacement therapy is typically innocuous. The risk-benefit ratio favors treatment even if the probability of a bleed is not terribly high in your mind. There is no harm in giving factor 8 or 9 to a hemophiliac who turns out not to be bleeding. On the other hand, leaving a bleed untreated can lead to serious consequences for the patient. For example, a patient presenting with a severe headache could be having an intracranial bleed, a large muscle hematoma can cause nerve or vascular compression, and even a few bleeds into a single joint may eventually lead to crippling arthritis requiring surgery. Okay, point 4. When providing medical services to a person with hemophilia, in the large majority of cases, it's possible to completely reverse the clinical phenotype of hemophilia and make a patient temporarily non-hemophilic. Therefore, hemophilia patients should not be denied necessary diagnostic or therapeutic procedures for medical conditions just because of their hemophilia. If there's an operation or procedure that your hemophilia patient needs, one that you would do on any other patient, with proper coverage, you'll be able to do it safely on this patient too.
Honestly, in EMS, we don't ask about bleeding disorders as often as we should. Hell, we ask about blood thinners and even erectile dysfunction medications, which, by the way, are generally not recommended. Sorry, fellas. Speaking of fun you should skip out on, it is generally not recommended that someone with a bleeding disorder drink alcohol. Next time there is a fire on a chilly night, I will try my hardest to remember this little factoid. Aspirin and NSAIDs are also generally not recommended. My doctor said I can take a couple ibuprofen after I infuse as a treat. There is a whole lot of other medications and foods that should be avoided if you have a bleeding disorder. Just like I imagine people with gluten issues have to do, I Google everything followed by and bleeding disorders. So ask a doctor about getting your kids tested for bleeding disorders. Do it before they play sports or reach puberty. Little girls with undiagnosed bleeding disorders can have serious complications when they start menstruating. And let's face it, little boys get injured like it's their full-time job. If you suspect you might have a bleeding disorder, get yourself tested. Also, be safe and take care.